Well, listen, as I mentioned, joining us live this morning, Sports Medicine Center at Akron Children's Hospital, our very good friend, Dr. Joe Kimgini with us. And Joe, unfortunately, we necessarily didn't see it, but the injury we hear is gruesome. Many people did see it. Not my thing. I did not want to see it, but I hear it was very gruesome, and that's the knee injury to Nick Chubb, our fine running back of the Cleveland Browns on Monday night. And I was wondering if maybe you can expand on what you've seen or heard about this injury, and then the question marks about that road to recovery for Nick.
Yeah, Ray, thanks. This is just one of the unfortunate things about sports, and particularly one of the things about football. It's an injury that's fairly unique in football. In a career like mine, you see a handful of these, not a lot of these. But I did see, for purposes of trying to understand it, and there were, on the social media, there were a lot of pictures of it, and I did see the pictures of it, and gruesome is probably the best description of what it looks like. Unnatural movement of the knee. It's not the way the knee is supposed to bend, and so from the standpoint of the pictures of what we saw, very concerning knee injury with multiple ligament damage. They've already announced that he's out for the year. And so what ends up happening with this injury is some people call it a wipeout injury. Many people medically call it a terrible triad is the old name. It's been around a long time because not just one ligament, the middle ACL ligament, but for the knee, when it gets hit and bent this way, it usually leads to a knee dislocation. Again, we don't know. We weren't there with Nick Chubb, but I have been on the sidelines with a handful of athletes that have had this wipeout injury, and they tear not only the ACL, but usually the medial collateral, the bigger ligament on the inside, the MCL, usually the PCL, the one in the back of the knee, posterior cruciate, and sometimes some cartilage damage as well. So it's obviously a really big surgery to reconstruct the knee again, to try to fix it and bring it back together again is a real big deal. But even different than that, even above and beyond that, there's two things about this that worry us in the sports medicine world if there's a true dislocation of the knee, if in fact that's what we're dealing with here, as I have with some players in my career, is number one, there's often damage to the arterial system, the system that brings blood to the knee. There's a very large artery in the middle of the knee that's really at risk when you dislocate the knee and tear multiple ligaments for this blood vessel to get torn. And about 35 to 40% in the literature of what I looked up last night, and there's a lot been written in the last 40, 50 years of medicine on terrible triad, 30 to 40% get some arterial damage or bleeding in the knee, significant bleeding, damage to that artery, and that usually is in the first few hours. So that decision's kind of been made already. That's why when we see these in a high school setting, we send people immediately to the emergency room because they can really get significant bleeding, a thing called compartment syndrome. And so that's one major complication that makes this wipeout injury different, this terrible triad. But secondly is the nerve injury. And in the long run of what ends careers, it can often be the injury to a very important nerve in the back of the knee. The peroneal nerve is usually the common peroneal. It's a nerve injury. And many of these people just never get their strength back. They have weakness and sometimes foot drop and other neurologic complications. Those usually come on later. We don't know about those for months later after an injury like this. If indeed his knee was a dislocation, which is, we've seen it before, people talking now on social media about the Willis McGahee for the University of Miami in the championship game against Ohio State several years ago. A great linebacker from Notre Dame who played at the Dallas Cowboys, Jalen Smith, had this. He just could never come back because of the nerve injury, and his strength never came back. He was a wonderful player. But actually, one person you could point to is a guy by the name of Nick Chubb. Nick Chubb had a knee dislocation with a terrible triad in 2015. I believe it was against the University of Tennessee. And amazingly, he worked very, very hard for 18 months. That's why our heart goes out to him. I mean, I don't know him personally, but he just seems like such a role model of what we want in our athletes. His teammates love him. The fans just love the guy. He's endearing. He doesn't have to say a lot. He doesn't point to himself all the time, despite his incredible talent. And for those of us in the sports medicine world, we know what he battled through in 2015, 16, 17 to come back, get drafted, and be an exceptional pro running back. And that's what really makes this hurt a lot, too, on top of it.
Joe, let me ask you this, and you kind of stole a little bit of where I was going to go. He had a very, very similar injury, if not the same from your description there, back in college, and he worked feverishly to recover, meaning that this is the second injury to that same knee. Does it make it more bleak for him to recover from this? And I know you haven't looked at the x-rays or any of that stuff, but the same type of injury to the same knee, I guess from the outside looking in, that tells me, oh gosh, how can he do that? That knee is probably just saying, I can't do this again. Is that the case or not?
It's, as always on these Wednesday mornings, you get right to the heart of the matter. That's probably the biggest question right now. And number one, there's just not enough numbers to know for sure, research-wise, to point to how many, because remember, there's not that many of these injuries to begin with. In a whole career like mine, maybe 5 that I've seen in 35 years, but myself personally. But the other thing is, so then to have somebody have a recurrence in the same knee is unusual. A couple things one way or the other is to reconstruct it again. Can they find what are they going to use from the standpoint of what type of tough, strong tendon would they use to build a new ligament, the new ligaments in the area where his tear was. And so that would be a problem from that standpoint. I don't believe at this late of a stage that he had a lot of looseness in the knee. So I think from that standpoint, it probably may not take as long. But I would have to say when you look at the scale of weighing pluses and minuses of having had one of these, I would say it's going to be a long uphill battle. But I would say that, most of the time we tell people, hey, we're looking at 18 months, 16, 18 months to try to reconstruct it, hope that there's no significant nerve damage, and then go about the business of rebuilding it if you have it in you after that hard job the first time of 2 years of rebuilding it. So I'd have to say the answer in my mind would be probably about the same amount of time, but all related to whether he has neurologic injury. That's really the key here, is whether in 2, 3, 4 months he ends up with an injured nerve out of this again. Otherwise, I'd say it would probably be reconstructing, finding the ligaments to put in and reconstruct the ligaments that are torn, probably about the same amount of time as it took him the first time, having had this injury.
Joe, you've talked about it a couple of times during this conversation about the nerve damage. Just so we understand what that means with the nerve damage, does that take away the function of the knee, the strength of the knee, both? Get into detail a little bit about if there is a loss of knee, if there's a nerve damage in that knee, what does that mean to us?
Okay, so in the studies of people that have had dislocation in the knee and the terrible triad with it, it's about 25%, about 1 in 4, get injury and damage to that knee. Sometimes they get just fairly superficial damage, but typically it's enough damage that they have weakness. And again, you hit the nail on the head. How in the world, when you're at full strength, can you play a sport that's as strenuous as football? But if you have an injury that leaves you with weakness in your lower leg, weakness in your ankle, foot drop, inability to push off at full strength, how in the world can you compete with the highest level athletes that are, that we have out there in that sport of football, which is where it happens mostly? So it is the biggest problem is the weakness that comes from the injury to the nerve after this injury.
All right, Joe, great information this morning. Thanks. So many people were wondering everything that you talked about there in regards to Nick Chubb. And like you said, and again, like you, I don't know him personally, but when you hear him and watch his demeanor, he's a guy that seems like you want to know. We're all rooting for him, and you kind of laid it out there, what lies ahead for him, one Nick Chubb. Thanks, Joe. Always appreciate it, my friend.
Sure. We're all rooting for him, and prayers for him as well, and for all the hard work, and thanks Ray for shining a positive light on it and bringing it back to some of the things that are outside the sports world. It just with a young man like that, that's what breaks our heart a little bit, is knowing how hard he works and what a good guy he is.
No doubt about it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, on board with us this morning, laying it out on what he knows and sees of maybe what happened with Nick Chubb and that knee injury from Monday night.